Welcome back to our discussion on your health this Wednesday, and we are discussing men's health. When do men seek health services, and why is it that women outlive men? Is it because of their health-seeking behavior? Is it because of their lifestyle? Are they more exposed to harmful things around them and in their work environment? And we had gone to the streets and asked several men what it is that they do. Do they seek services? Do they go to hospital? And this men we spoke to in Nyeri had this to say.
I do visit the hospital oftenly after getting sick, but not very much. But I do go to the hospital. I don't usually go for checkup. I usually go when I'm sick, when I need some treatment.
Mimi huwa siendi kufanywa mambo ya upimaji ama check up or testing. Huwa ninaenda wakati ambapo nahisi ya kwamba ninahitaji kuona daktari nikiwa na maumivu kwa mwili. Lakini kwa wakati huo mwingine sionagi umuhimu wa kushinda nikienda nikifanywa testing. Hata mimi ni Mkristo, naamini ya kwamba I'm supposed to have a good health at all times. So that is my belief.
I often don't go to hospital much, mostly when I'm unaware, and at times when they are offered some tests. You know, they are free tests. We usually like to visit those people, for such an education brand.
Okay, Susan, you've heard what they have to say, and the gentleman there is like, he's a Christian, so he hopes for the best. And we know you have been taking care of your husband. Just give us just a bit of what that has been like for you.
I've been taking care of my husband for 8 years now. He was diagnosed with Alzheimer's. You know, I used to call it early onset, but a doctor told me it's young onset at 48 point something. So when he got sick, I didn't know what he was suffering from, you know. And before that, I could see he was not okay. Then I would tell him we go to hospital, and he would decline. You know, for a long time, he refused to go to hospital. Mm-hmm. So finally, even when we went for the tests, it was my initiative. He didn't want to go. So he was diagnosed with that, and you know, I had taken a long time looking for solutions and finding out what is the problem. Doctor after doctor, you know, nobody was telling me what is wrong. Stress, depression, others, memory loss. So by the time I came to know it was Alzheimer's, it was 4 years down the line. So I had never heard of the word Alzheimer's. It was a new word to me. I didn't know how to deal with it, and it is really a challenge. If you have no information about Alzheimer's, which is a type of dementia, you are in for a surprise, because this person just goes, becomes agitated, stops doing things. He doesn't want to do anything. Forgets to do things, forgets to shower, forgets to go to the loo, all those things. So dealing with that for the last 8 years, it has been a challenge for me and the children. But I thank God, with time I found help. Mm-hmm. I found a support group. Mm-hmm. It's called ADOK, that is Alzheimer's and Dementia Association of Kenya. And under the chair of Elizabeth Mutunga, mm-hmm. who is also a psychiatrist. She really took me through a lot of what I needed to know, mm-hmm. to handle my husband, because I went into depression because I didn't know what I was dealing with. Mm-hmm. But since I met that group, mm-hmm. It has eased my pain. Okay. Yeah, I'm able to deal with it. Okay. Yeah.
No, gentlemen, yes. Your men, your doctors, from Susan's story, really, men are literally carried to the hospital for their own health. What do you have to say about this?
I think to change that narrative, we have to all have concerted effort. And I guess the buck must stop at the health facilities and the health practitioners themselves. Because you see, it's going to take a proactive approach from us to pass this message to the men around us. and even perhaps to our sons while they are still young, that taking care of your body is really the best investment that one can make in life as you go about getting degrees and acquiring properties and things like that. So perhaps from a personal point of view, I should begin to think seriously about, for example, the men I saw in Nyeri, and how would I make it easier for them to literally walk in. And men also pretend to be very busy. So, and the patience that women have, men don't. So the whole issue about spending 2-3 hours in the queue is very difficult for a man. And so perhaps we need to look for a way of having like an express method to fast track men who are coming simply for checkups. Do a package, as I said, that checks beyond sexual health and prostates and bladders and so on, and basically give men opportunities to have their blood pressures taken as they walk on the streets, have their weights and body mass index taken, have their sugars taken. Perhaps like other enterprises do, we need well-manned kiosks on the road and capture every man and tell him, as you go about going to pay for your plot, please, let's have your blood sugar. So that you don't go and you're told a very high price and then you collapse.
And so, Doctor, are there any initiatives to have men-friendly facilities in hospitals? We have baby-friendly, we have female-friendly. Are there any initiatives to have men-friendly facilities?
I'll actually talk of two. The very first one, Dr. Ari has alluded to it, and I would like us to look at these men from when they are boys, because you heard my sister saying here that even her boys also are very difficult to respond to pain or to behave in a way that is healthy. Now, when you look at the determinants of non-communicable diseases, for example, alcohol, tobacco, sedentary lifestyles, they don't start at adulthood. They are behaviors that are reinforced during young ages. So even when we are talking about prevention and proaction, it's not an adult thing. It's a whole of family thing. That's the first thing. Two is we are trying to change the narrative and making hospitals, I don't like calling them hospitals. They're health facilities. They're supposed to espouse health. When you call them hospitals, they are places for the sick. They're not only for the sick. Even a healthy person like me who is conscious and says, oh, I have had Masikandi on TV and I need to go. Where do you go? So if you arrive in Nyeri, let me use his facility, and you go to the outpatient, you find a clinical officer who has a long line of very sick people, genuinely. Now, you keep coming in the line. You're not sick. Then you arrive there and he's like, what is the problem? You say, I'm not sick, I've just come. The first reaction that CEO has is annoyance. He's angry. He's like, look, you're even in front of a child with asthma. You're even in front of a mother who is bleeding. What do you want? So the hospital does not embrace people who are seeking wellness. So, and probably that is not the mechanism. So we said, in that environment, it's the wrong place to expect the CEO to stop the emergencies he was doing to, take you through easily, BP, sugar. Maybe there should be another way. And you're trying to advocate for wellness clinics in hospitals. Just a desk manned maybe by a nurse or a room or a tolerance on some particular days where you are not sick. You don't need to spend a whole day in the hospital. You are building the nation. So you can just detour in the hospital. Maybe you are a tout in a matatu. While your matatu is in line waiting to fill, you just duck into the hospital, you go to the clinic, the wellness clinic, you find a nurse who gives you a package of, thank you for coming, in a friendly way that is not threatening. There are no sick people around you who you are feeling mercy now. So then there is the issue of the lab. You should not queue so long because anyway, you're not sick. So we have either way of fast-tracking you to the front. That once you leave that place, you will encourage another. That it's not such an ordeal to go to hospital pre or before you are ill. That's one. And then two is to try and put these services in the way of men because they will never come. So we try and interrupt their normal duty, screen them in wherever they are. There's a program that we were doing with AstraZeneca to try and upscale hypertension screening. Halfway through the project, we reviewed how many people we had screened. We have screened like 1 million women and probably 100,000 men. It was terrible. And so we said we must go out there and actively look for the men. Because if we expect them to come in passively, they will never. So we make it easier for them. So in a way that is friendly to them, take it to where they will find, in their barazas, in their talks, in their meetings. So every time there is a church group meeting, there is any gathering that has men, we try and use our officers to go and talk to them, the community health workers, to use those opportunities not to disrupt the social structures, but to fit within the social structures to at least reach to the men.
Okay. So now, from all that and listening to Susan, is it then correct to assume that men's health, at the end of the day, is a burden of the women, or is still a burden of the women?
Invariably it is, but because of the way we are structured, let me give an example and maybe look at the opposite of what happened to my sister here. Suppose it's her who got the dementia, and she was down, depressed, not productive. I don't know about the husband, but how do you expect the same response to have been from the man? Women, of course, are compassionate. And you hear the statement that we are their firstborns. It's true, anyway. Women need a lot of care. And we must thank women for being proactive. But also remember the social structure of how we have been structured. For the women, and look at even the way the government looks at health, maternal health, child health, those are flagship projects. We spend money on women's health because of their maternal nature. But men, we don't even have a men's program. We don't have a division for men's health. It's one of those small little things we borrow around. So I think we need to, it's a total change of the way we approach things, right from policy to practice.
Dr. Mbuthia,
yes.
Is men's health primarily a burden of the women?
To the extent that when a man is unwell at home, everything sort of comes to a stop. When a woman is unwell, you may not even know, because she might still be going on with her own duties. The paradox is actually that men don't have a very poor health-seeking behavior. But when they're affected by what one would call a very minor illness, like a small homa, now the whole world has to come to a stop because Mzee is unwell. And so the women are in this place where they take care of themselves, and when the man is unwell, they have to take care of him. So it's really a paradox, because a man gets unwell and, everybody really has to attend to him. But I think the narrative of men's health is really what I would want to be a take-home message today, that a man is, just like a woman in terms of everything a woman has, in terms of blood flowing through vessels and hearts beating. And so one of the things is that, when a woman, for example, goes for an antenatal care, she gets an opportunity to have a blood pressure taken, sugars taken, certain infections looked for. Because men don't have that kind of opportunity, it's really up to them. Because at the end of the day, your health will start with you. And so even though your wife is there and she's cajoling you, please go to hospital and so on, men must man up and take care of their own health. And they must know they have many areas that they can be attacked by illness. And Dr. Pasho here knows really that the whole issue around non-communicable diseases is as a pandemic in men as it is in women. And so, for example, when I treat elderly patients who have come with, say, a prostate problem, many times we find what we call comorbidities. You have to actually settle their blood pressures first, settle their sugars first, before you even deal with the reason that they came. And so that narrative of health is beyond just what men's health has been said to be, must come out of, must get out there, and perhaps men will start looking at health a little more seriously.
Okay.
Yeah.
Susan, I'll still pose the same question to you. Is men's health at the end of the day a burden of women?
I think so. I think that statement is really very true. Because, I normally wonder why men don't want to go to hospital. And when you ask him, why don't you want to go to hospital? He'll tell you, I'm busy. I'm busy. Or he doesn't want to know what is happening to him. Yeah? Or he doesn't want to be asked so many private questions. Some may even be scared of removing the clothes and wearing that gown in the hospital. Or they'll tell you that room is normally very cold. So they'll just give you a lot of excuses. So generally, it is the responsibility currently, he said they need to change that, of the women to make sure that their husbands go to hospital.
And it's interesting that you say they don't want to be asked many questions. One of viewers is saying that when men go to hospital, men do not go to hospital because they don't want to be asked all those very many questions that, you know, doctors ask. But these questions are important, right?
Yes,
because that is what will guide the doctor in figuring out what is ailing the man and what needs to be done. Now, there's the mental aspect of health, which affects everyone.
Yes.
And I would think men particularly so, because men are said to be busy, up and about every day, the stress they encounter and everything. Do men acknowledge or accept when they need mental, mental attention or mental health attention? I'll start with you, Dr. Mbuthia, because you see the extremes of age.
So I think the whole issue around mental health also needs to come out very clearly, because a lot of people equate mental health or mental illness to the guy on the street who has removed his clothes and is shouting. But the fact is, just by a casual look at men and how they spend their time, and why many are found in alcohol and drugs, they are battling serious social stressors. But they have found a different way of trying to sort it out. So again, we need to expand the whole issue around mental health. Okay. It is not madness, as people, think about it. Yes. It is just the ability to wake up, the ability to be motivated to do what it is you have to do, the ability to deal with stress. And so if men again agree that they all need to be mentally healthy, they will not wait until they have collapsed. And again, what happens is that whenever a man now comes to a health facility in serious illness, invariably there's depression in this gentleman. And he also has many questions, because as a vicious cycle, the fact that men come to hospitals late, that means a lot of their friends who they know about came to hospitals and perhaps passed on. So they associate hospitals with very dire outcomes. And they just keep it there. So mental health is really beyond what people would call psychiatric manifestations and so on.
Okay.
Yeah.
Now, I'd want us to just do a closing comments. And what I'd ask from all of you is, what then should men watch out for? Like, what should they really be keen about when it comes to their health? Now that we've said it's not just what people have assumed men's health to be. And I'll start with Dr. Kibasho.
Right. I'll reiterate what I said, that health is not just the mere absence of disease. It's broader than just having an illness. And for men, I would say, and I would, as the debate raged, we agreed that the responsibility rests on the self. People around you might help you, but yes, the responsibility starts with self. There is a small little battery of tests or examinations that you may call basic. As I had said earlier, the NHIF had wanted, and we are in the process of activating that, making sure that every year, annually, you have an opportunity to be screened for you to be covered, because to them it's cheaper to take care of a patient who is discovered early. So check your blood, as Dr. Ari has talked about, the pressures, the blood sugars, the cholesterol, the BMIs, and the education. And a general exam will do you good. We always say, at least if you could give yourself a birthday present on that very day, one in a year, please go and get yourself checked. And the best thing for a man is to lead from the front. Go with your family. It's easier when you're doing it with people or with colleagues, because as an individual, you find like it's a sign of weakness. But go with friends or family to make it easier.
Okay. Dr. Mbuthia, what should men watch out for when it comes to their health, apart from what Dr. Kibasho has said?
I think the issue is that if they watch out for something, they may not go to hospital at all. Because a lot of the non-communicable diseases, for example, are painless. And they have really no symptoms until their last stages. And so to cut the chase, let men walk into health facilities, let men walk into clinics, and let them have basic tests done.
Okay.
And it is in the midst of having some of these basic tests done that a question will come here and there, and perhaps escalate this to something more. Okay. Because if I sit here and tell men, watch out for this, a lot of them will say, actually, even Dr. Aria said this. As I feel now, there's nothing that I'm feeling. And so let me continue not going to seek health. Yes.
Susan, just briefly, from your experience, what should men be keen about on their health?
I think men should be keen on their health as far as health is concerned. And they should, the way they do to their women, if you get a cold in the house, you will notice and you will insist that you go to hospital. I want them to do the same to themselves.
Thank you.
Yeah.
Thank you very much. So today on Your Health on Morning Express, we are discussing men's health in general. And the question we had asked and posed to you is, when do men go to hospital? And 38% of you said that men go to hospital when taking a family member, and 27% said when they are sick, 22% saying when they are visiting an admitted friend, and 13% said that men actually never go to hospital. So that's all that we had for you today. With me in studio was Dr. Mwangi Kibasho, who is the head of the Non-Communicable Disease Department of the Ministry of Health, Dr. Patrick Mbuthia, who is a urologist from Nyeri County, and Susan Kimondio, who has been a caregiver for the last 8 years. Join me again next Wednesday as we discuss another issue that affects your health. I'm Dr. Mercy Korir, and I wish you a very good day. I'll hand you over back to Michael Gitonga.
Thank you very much, Dr. Mercy Korir, and your panelists. And I've certainly taken notes right there. And I will be the first one to admit I cannot remember the last time I was in a hospital. But my take home is that it's not just a hospital, but it's a health facility. And that completely changes how I look at it. So I will make sure that by next Wednesday, I will have visited a health facility to ensure that I'm still healthy. So thank you very much. But from here in Morning Express, we'd like to wish you all a fantastic day. Thank you for staying with us. And well, we'll now say goodbye and wish you a good day. But do stay with us right here on KTN News. We do have News Center coming up with Betty Kialo, and I'm sure she's got loads that she will update you on news and reviews. Do have yourselves a productive day and a healthy day. God bless.